Let's get started. Thank you all for sharing in the chat. It's so wonderful that we have so many people here today. We appreciate your time. My name is Mimi Amareji. I am the Director of Outreach and Retention for the UCSF School of Nursing. Before we get started, I want to give it over to some of the speakers that we have here today to make some introductions. I'm going to start first with Dr. Zavala.
Thanks, Mimi. Welcome, everyone. It's great to have you here. I am the Assistant Dean for Student Affairs, and my role here tonight is to support Mimi, some of our great faculty members, and then answer some of your questions related to the process for applying or some of the requirements. We will try to address all of your questions tonight. If we are unable to, I will definitely follow up with you personally and address it for you. Dr. Waxman.
Thank you, Dr. Zavala. I am going to kick us off today. I am KT Waxman. I'm a professor and director of the Doctor of Nursing Practice program here at UCSF. Tonight, we are going to talk about the BSN to DNP program. Dr. Mary Lynch is on the line and on the Zoom as well, and she'll answer questions at the end. So we're going to start with our agenda. We're going to do an overview of the program. We're going to talk about the specialties and introduce you to our specialty coordinator faculty. We will have questions at the end. We'll talk about the program structure, application and requirement process, and then we'll go into next steps if you have any questions regarding that. So I want to start first by talking about the difference between the DNP and the PhD. That's a Doctor of Nursing Practice and the PhD in Nursing. The DNP is a degree that originated in around 2006. I happened to be a graduate in 2008, so I was an early graduate of the DNP program. And I was hoping that one day this degree would be available because I didn't want to just do research as a PhD. I wanted to apply what I learned to the practice that I was in. And then the DNP came out, and it really looks at evidence-based practice and the translation of external evidence into clinical practice and policy to improve care and patient outcomes. The DNP generates internal evidence through quality improvement outcomes and management and evidence-based practice projects. Mentorship of others in evidence-based practice and creation of systems to sustain it. So really looking at the bigger picture, not just the micro system of where you work, but the macro system of how the work that you do applies to the systems, the people, the populations, the units, the divisions, and the whole big picture. The PhD generates research, evidence, and it includes translating that research to inform practice and policy. So they do a rigorous research study and a dissertation, whereas the DNP does an evidence-based quality improvement project. The PhD is an extension of the science. They generate evidence-based theories in which we would then apply to practice. And ultimately, the goal is for both improve patient, population, and policy outcomes. So it's really critical that we work together as colleagues to improve the outcomes of our patients and our populations. So the BSN to DNP is a practice-focused academic degree. And when we say practice, it's not all about the clinical component. In this program, we prepare you to be advanced practice nurses, but we also prepare you as leaders. So we prepare experts in evidence-based practice, quality improvement, and leadership. We blend the clinical, the leadership, the financial, economic components of healthcare and organizational skills in both direct, hands-on patient care and indirect administrative management practice to positively impact outcomes. We prepare students for advanced nursing practice and leadership opportunities in a variety of settings. The DNP is endorsed by many professional organizations as the entry level. The CRNA, which is the Certified Registered Nurse Anesthetist, have endorsed the DNP and require the DNP upon graduation. The CNS is looking at endorsing this beginning in 2030, and the nurse practitioner is positively looking at this DNP in 2025. So those organizations all have statements on their website that you might want to look at. The certified nurse midwives have not made a stance on the requirement for the DNP. However, UCSF School of Nursing has made a stance, and we are requiring a doctoral degree and preparing all of our students for CNS, NP, and nurse midwife at the doctoral level. So why would you want to do this? Well, there's a demand for highly skilled and specialized nursing professionals. We want to equip you with knowledge, skills, and expertise that's needed to navigate the complexities of modern healthcare. It's very complex now, especially post-COVID, with cost containment being so critical. A lot of complex patients with chronic diseases didn't go to the physician or a healthcare provider over the time of COVID, and now they're sicker and more chronic than ever. So we need more providers out there to take care of these patients, primarily in primary care as well. There's a shortage of physicians and nurse practitioners in primary care. We prepare you to be a leader of teams, whether you're in a clinic or in a hospital setting, anywhere along the continuum, and prepare you to influence healthcare policy. It's very important for nurses to be at the table, to meet with our legislators, look at policy and how it impacts patient care. The unique specialties that we have and curriculum are tailored to ensure student success. So the roadmap of the BSN to the DNP is you have your post-baccalaureate degree in nursing. You apply, you get into the program. We have a cohort model. Our program is designed for all the students to start together and end together, and that's our goal. It doesn't always happen that way, but we want you to stay connected. Many of our cohorts in the postmaster's program have connected and stayed together for years as colleagues in virtual environments. We even have a LinkedIn group set up for them. We admit in the summer. It'll be summer of 24 in June. We have 12 continuous quarters. We go all through the summer. We do not stop. And it's a hybrid program, meaning that you may come to campus in June for orientation and lectures, guest speakers, about a 3-day session in June. And then the rest of the quarter is all online. And then the next quarter would be online, and the clinical piece would start on the third quarter. So you would have to come for your clinicals, and I'll let the specialty coordinators talk more about that. Your clinical hours will be up to 760 hours, which is the requirement, and 240 out of the 1,000 as a post-bachelor's student. You're required to have 1,000 hours of practicum. 760 of yours will be in the clinical area, and 240 would be in the administrative area, and when you wrap up your final project. And you culminate with an evidence-based quality improvement project. So our EBQIP, which is evidence-based quality improvement project, should focus on the scholarly translation of research and evidence. So you'll do a thorough lit review to look at what the evidence says around this topic or issue that you have discovered or are passionate about. You'll focus on practice improvement, quality improvement. It may be a compliance issue that you want to deal with, and your advisor and chair will help you narrow this down, because oftentimes our students really want to solve world hunger, if you will, and we have to help them narrow it down to get it accomplished in 4 academic quarters. You'll need someone at your site as a site liaison to support you in the implementation of your project. And once you implement it at the system or population level, you will then evaluate any outcomes. And this is a QI evaluation, not a research evaluation. The link there, and you will have access to these slides, talks more about some of the programs, actually the projects that some of our students have done, so you can get a look. Here are some, you can read through. I'll just highlight a couple of titles of some of our recent DNP projects. Structured medication reconciliation of older adults in the ED, improving handoff communication in an inpatient psych setting. Nurse leaders perceive knowledge and confidence managing disasters in an acute care setting. So you can see that we're looking at homeless, tobacco recovery, medication adherence, diabetes education. So that gives you a flavor of what you would be doing your project on. Now, here are our specialties, and then we'll move into talking a little bit more about each of them. We have nurse midwifery, clinical nurse specialist, adult gero and neonatal, health policy and public health, nurse practitioner, adult gero, acute care NP, adult gero primary care NP, adult gero primary care NP, occupational environmental health, neonatal NP, acute care pediatric NP, pediatric NP and primary care, and psych mental health NP. Those are our specialties that we're offering at this time. So let's talk about next is physiological nursing, adult gero clinical nurse specialist. Turning that over to, is that Astrid?
Hi, my name, yes.
Okay, thanks, Astrid.
Hi, my name is Astrid Block. I'm the specialty coordinator for the adult gerontology clinical nurse specialist track. There are two subspecialties, one in oncology and critical care trauma, but all of the coursework is the same for adult gerontology clinical nurse specialist students, and most of the specialization comes in the clinical rotations. And we have students who are in outpatient settings and inpatient settings and critical care settings, depending on where they practiced as a nurse and what setting they're hoping to work in as a clinical nurse specialist. Clinical nurse specialists provide direct care to complex patients. They also provide staff and nursing support in an educator role, and then work on process improvement and systems change at the macro level. So the DNP is a perfect match for the clinical nurse specialist role. And I welcome any questions that you might have about this specialty. Feel free to reach out by email. We share a lot of courses with the adult gerontology acute care nurse practitioner track, and I'll hand over the podium to their specialty coordinator, Lisa Gerton.
Hi, thank you so much, Astrid. Welcome, everybody. My name is Dr. Lisa Gerton, and I would like to talk briefly about the Adult Gerontology Acute Care Nurse Practitioner Program. So this specialty requires 2 years of nursing experience in order to apply or be admitted into the program. And that experience, we would like to be in the acute care setting, so in the hospital setting. So what an acute care nurse practitioner does is they manage complex, critically ill and patients with chronic health conditions in the hospital setting. They perform diagnostic testing and formulate management plans, collaborate extensively with interdisciplinary teams in the hospital setting, and they are dedicated to population health. So the management of chronic diseases, setting the patients up for success when they discharge from the hospital, and then ensuring that there is quality metrics that are established within the hospital setting or in your practice setting, and then working with COVID, right? Public health and health policy have really become a critical component of the acute care setting. So they work with older adults and adults. They practice in the hospital, so in the acute care setting or the wards. or in the critical care setting. And if there is an emergency department that sees adult patients, and the credentialing bodies are the same as the CNS, so the American Nurses Association Credentialing Center, ANCC, or the American Association of Critical Care Nurses. So if you have any questions, I will put my information in the chat, and I'm happy to discuss with you further. Thank you.
Hi, I'm Marianne Israel. I'm the specialty coordinator for the Primary Care Pediatric Nurse Practitioner program. This specialty is perfect for those of you who enjoy working with children in many different types of settings. So our role is in management of primary and preventative care, in health promotion, anticipatory guidance, and growth and development. So a lot of the care in the outpatient setting, but we also work in managing common and chronic health conditions and in episodic illnesses. We do a lot of focusing on promotion of health equity and addressing health disparities and working with diverse and underserved populations. Our populations are from infancy, so right from birth until young adulthood. As I said, we work in many different types of settings. So we're in outpatient clinical settings, we're in hospital outpatient settings, we're in specialty clinics, community clinics, school-based clinics, urgent cares, and I'll be here too for the rest of the evening and always available by email. So I'll drop the email in the chat too if you have any questions about the specialty. Thank you.
Hi, everyone. Thanks for being here tonight. My name is Brittany Christensen, and I'm the specialty coordinator for the Acute Care PNP program. I'm sorry I have my camera off. I'm having internet issues today, and I don't want it to go crazy. But our specialty does require 2 years of pediatric acute care nursing experience to apply. So we work at a different end of the illness spectrum than primary care PNPs, and our role is with specialized physiologic and psychologic needs of pediatric patients that have complex acute, critical, and chronic health conditions. We do performance of diagnostic and therapeutic interventions along with complex monitoring and ongoing management of acute and critical episodic illness. We also take care of children that have exacerbations of their chronic illness, and that includes palliative and end-of-life care as well. So our program trains ACPNPs in a generalist role, but many of our graduates go on and work in specialty and subspecialty areas where they have different, more focused training in some of those settings. So our pediatric population is from infants all the way up to young adulthoods. Places where you will find an ACPNP practicing is in inpatient hospital-based settings, as well as outpatient specialties that are tied to hospital roles. Pediatric emergency departments and intensive care units, and then home care. And there are some very specific subspecialty areas that continue to emerge as more and more children are needing management of critical illnesses and different complexities. So our credentialing body is the same as the primary care group. The Pediatric Nursing Certification Board, there's a lot of information on there about the ACPNP and PCPNP roles as well. And I will put my email in the chat for further questions. Thank you.
Hello, my name is Elizabeth Castillo, and I am one of the specialty coordinators for the Family Nurse Practitioner program. And we're really proud of our program. We recognize that many people face barriers in underserved and in other marginalized groups throughout the country. And so that disparity has led to decreased access to care, unfortunately increase in the risk of poor health outcomes. So our role as family nurse practitioners is for the management of primary care and chronic complex health conditions, including reproductive care. And we also focus on promotion of health equity and addressing health disparities. So our patient population is that across the lifespan. So most of the time you will see a family nurse practitioner in an outpatient or an ambulatory care setting. That includes federally qualified healthcare facilities, primary care community clinics, whatnot. And so hospital clinics, community school-based clinics, and oftentimes in specialty practice as well. And then also sometimes you will see family nurse practitioners in urgent care and emergency rooms. Since, again, we kind of do full spectrum care, our credentialing bodies include two, that is AANP, American Association of Nurse Practitioners, and ANCC, the American Nurses Credentialing Center. So if you have any questions for me, I will put my email in the chat. Thank you.
Hi, I'm Chrissy Gallagher Smith, and I'm one of the specialty coordinators for the neonatal nurse practitioner and the clinical nurse specialist role for neonatology. This also requires 2 years of NICU experience to apply. It can be in any NICU setting. Specifically regarding the neonatal NP, the role would be direct patient care with complex medically fragile neonates and infants, and some convalescing well infants as well. They practice in the NICU setting in a facility, and the credentialing body for the neonatal NP is the NCC, the National Certification Corporation. And there's details there on that website when this PowerPoint is released to you. In addition to which, we have the neonatal CNS, which the role is to be, really, it's a 5-point way that we handle the CNS. And when we're not only looking at clinical care, but education, research, consultation, and clinical leadership within the NICU. And their credentialing body is through the American Association of Critical Care Nurses, the AACN, and the website is listed there. I'll put my name in the chat and feel free to reach out with any questions. I'm always available to have a chat. Thanks for joining tonight.
Hello, everyone. Good evening. My name is Amber Bell. I am a faculty here and I'm one of the co-coordinators of the midwifery specialty along with Kim Doe. So a little bit about the role of the certified nurse midwife. So the midwife typically provides comprehensive sexual and reproductive health care throughout the lifespan, which is inclusive of pregnancy, of course, and also care during the years outside of pregnancy. Learners in our program take care of people in the outpatient setting, so in the clinic, and also in the inpatient setting on labor and delivery. Although we also recognize that the scope of the nurse midwife can also care for people at home and at birth centers, our program currently offers clinical opportunities in the clinic and also on labor and delivery in the hospital. What else? Oh, yes, our credentialing body is the American Midwifery Certification Board, AMCB, for certified nurse midwives. I'll also put my name and contact information in the chat.
Jane here tonight?
You know what? I don't know if the faculty is here, but I am more than willing to talk about our Psych mental health nurse practitioner program. This is a great program and really addresses the growing issues both locally, statewide, and nationally on the needs of individuals, both children and adults, who have behavioral and psychiatric mental health concerns. The Psych mental health nurse practitioner program is a heavily subscribed program. The primary area is in clinical care that supports a biopsychosocial structural assessment and diagnosis of patients across the lifespan with mental health disorders. Part of the role involves medication management and psychotherapy, And the focus really of this program is to address health inequities, particularly in relation to providing mental health resources for those underserved and marginalized populations. The population focus is lifespan. The practice setting really can span the whole healthcare environment, including emergency room settings, outpatient and inpatient and primary care settings. The credentialing body is the American Nurses Credentialing Center, and we hope that you'll consider our Psych mental health program as a priority for your DNP education.
Thank you, Dr. Lynch. We sing?
You know what? I
How
can.
about Dr. Lynch once again?
I can step
Okay.
in here, unless we hear somebody else. Okay. So the Occupational and Environmental Health Program is a component that individuals can participate in, but they're also part of our adult gerontology primary care practitioner program. So individuals are in the AGPCNP program in addition to doing the extra coursework for a focus on occupational and environmental health. So it's a dual preparation. OEH nurses, I've really learned a lot recently about OEH nurses. They play a really important role in large and small settings, where the whole idea is to really help individuals in the workforce stay healthy. Which sounds like a no-brainer, but actually is something that's taken a while to evolve. The OEH program is a federally funded program, and there are stipends that are available for students who are part of the program. So in addition to working with the population that is primarily adults, including older adults, this focus is specific to different types of work environments. So some of the work environments where our students have worked as students and as graduates involve things like fire departments, to try to make sure that such an at-risk population can be as healthy as possible. Looking at other energy kind of related environments where there can be exposures. The tech force has really begun to incorporate more adult geri nurse practitioners with an OEH focus. There is a hospital-based practice setting, certainly. And again, the other areas can include areas such as orthopedics and pulmonary practices for OEH focus. The credentialing is for, first off, the nurse practitioner, which can be from the American Academy of Nurse Practitioners, and then or ANCC, and then there is a specific certification exam for OEH and nurses. So again, a great opportunity for any of you to consider when you want to look at the well-being of individuals in the employment environment. All right, back to you, Dr. Waxman.
Okay, next slide.
Oh,
Hi, my name is Yoonmi Ju. I'm
great.
one of the specialty coordinator for the AZPCNP program. So our AZPCNPs are advanced practice nurses. We are taking care of acute and chronic illness in people from adolescence to the end of life. So we also do provide health education to people and groups. The major part of the role is disease prevention and health promotion. And we offer specialized clinical experience for students in the HIV focus. Mary just to go over OEH focus, that's a dual specialty with us. And then we also provide geriatric scholar program, or San Francisco VA, we have an interdisciplinary program we called APAC. So the population is from adolescents to the, I just mentioned, to the end of life. So we work a lot of different settings, including primary care, urgent care. So it is in the community setting and the health maintenance organization and the specialty clinic. We also do the like palliative care, correctional facility, and work with private medical practices. So feel free to ask any question about our program in the chat or email us. Thank you.
Thank you. Now we'll turn over to health policy and public health. I think
Yeah. I'm here, Stella.
Stella's here. Great.
Yes. Hi, everybody. My name is Stella Bielas. I'm speaking on behalf of Susan and Kate, who could not be here today, but are the specialty coordinators. So our health policy and public health program, it's really attract nurses who may or may not be into being nurse practitioners or midwives, which are all fantastic jobs and fantastic career paths, but are nurses who are trying to make a change at a system level. Some of them are really passionate about public health and want to work in public health clinics, public health departments. Others are really passionate about making policy change at a system level. So you could be an emergency room nurse who got really trying to say, well, maybe these people should be seen at primary care. Why am I seeing these patients in an emergency room? So that's the sort of thing we do. We have a very background, my personal background is on med surg. So I moved from, going upstream and trying to solve problems more at a system level and see how we can make these changes to improve the health of populations and patients at all levels. And so that's what we really focus on. We have a big, like everybody, and you may notice that's a big focus for our School of Nursing. The addressing disparities and promoting equity is a big focus for pretty much all of us, including the health policy and public health program. I want to say that our residences or the places where you do your practice may vary from a local health department to a public health clinic taking care of HIV patients or people who are unhoused, to the World Health Organization or the US Congress. So it really depends on what your interests and where you want to make that change is. And we are going to work with you to customize so your experience will meet what are your areas of which you want to change. So again, if you want to be more at the local level or the institutional level, we'll provide opportunities for you to understand how to make changes in public health and policy at that level. And if you want to go all the way, to Congress or to the World Health Organization, we will work with you to make that happen as well. So feel free to contact us. We don't have credentialing center, so there's no credentialing necessary, no exams. And I'll put my email here in addition to Susan and Kate's emails already on the slide. Thank you.
Thank you, Stella. I'm going to turn it over now to Dr. Zavala, I believe.
Thank you, Dr. Waxman. So thank you so much to our amazing specialty coordinators. As you have heard, plenty of great opportunities, specific information was provided. I'm going to talk briefly about the admission requirements for this program. So you do need a bachelor's degree in nursing transcript. You can submit an unofficial copy, but if admitted to the program, we will need to get an official copy of that. If you have specific questions about any of these requirements right here, please drop me a note in the chat and I'll follow up with you specifically. One of the key things that we're asking applicants or folks that are interested, that as soon as you start an application that you choose a specialty, if possible, so that we can connect you to one of our specialty coordinators and they can provide additional support for you. You do need a California nursing license. I know that some of you are out of state and are working on this right now. So make sure that we have a copy of it before the application due date, which is March 1st. Goal and personal statements are key components of the application. Some of our specialties, or the majority of our specialties, are asking for 3 letters of recommendation. Some of them are asking for 4. And there's specific requirements as to where they need those letters of references for. Every one of our specialties within the application has this key information. So make sure that you go through it and you read it. If you're unaware or still have questions about that, please feel free to reach out and we will support you. We need a curriculum vitae or a resume. You need a recent statistics course. It could be college level. It has to be from an accredited institution, whether it's a college or a university, and it has to have been taken within the last 5 years. And applicants will be invited to an interview at some point during the application process. Briefly, some additional components that we think are important for you to know. UCSF has amazing support resources for students. They occur within the School of Nursing, and they also are provided at the university level, from disability support services to international student support, to DACA support for those that need it, writing support, counseling support. I think there's close to 17 different departments that offer support to students. With that being said, we're really happy that you're considering UCSF and are looking forward to supporting you in this process. And I will hand it back to Mimi.
Thank you, Joe. Again, thank you all for joining us this evening. I want to say a big thank you to our specialty coordinators. As you see in the chat, they have shared their information with you. But I also wanted to share and highlight that if you are in the process of working on your application and you need any type of support, either with, walking through your go statement or just having a better understanding of the application process, we do have one-on-one sessions for students who are currently working on the application and students who are just interested in learning more about the program as a whole. These are our contact information for our nurse and admissions email. You can see it right there. Dr. Waxman's email as well as Dr. Zavala's email and my email as well.